The hugely popular Ozempic is dominating headlines and the drug market as more and more Americans are asking their doctors about these injectables and other similar products that help with weight loss. There is also growing concern. Just this week, one family came forward blaming Ozempic for a 56-year-old woman's death in Australia ahead of her daughter's wedding. This as dozens of hospitalizations have been reported after individuals used suspected Ozempic counterfeits. The FDA is now investigating those claims. And one piece of news making headlines this week, manufacturers now testing whether these drugs can be used to curb obesity for children as young as 6 years old. Here to help us break all of this down is Dr. Eli Fitch, president of the Obesity Medicine Association, also founder and chief medical officer for Knownwell. Doctor, thanks so much for joining us.
Thank you for having me tonight.
Let's start with the headline about children. These drugs being assessed to possibly treat pediatric obesity, and that includes kids as young as 6 years old. What are your thoughts about using these for kids that young?
So Wegovy, which is the obesity treatment version of Ozempic, semaglutide, is actually approved already down to the age of 12. So for our adolescent patients with obesity, they have a treatment option finally beyond just working on their diet and exercise, which has been shown to be not very successful, unfortunately, for people with obesity, including children with obesity. So it's a very important step forward to have access to an effective treatment so that kids with obesity don't have to have obesity into adulthood and therefore reduce their risk of other diseases such as diabetes, hypertension, cardiovascular disease, and the like.
Yeah, we know it's associated with so many of these other things. I do want to ask you about another headline this week. Eli Lilly's drug to treat obesity, Zepbound, approved by the FDA. It is predicted to be available by the end of this year. Why is this being hailed as game-changing in a lot of these headlines?
Well, these drugs are life-changing for many people. We have to remember that. I mean, these drugs are really changing the way we treat obesity. For people who take Zepbound or tirzepatide, almost over 60% of people who take it are able to lose greater than 20% of their weight. When you launch into a lifestyle-based effort, such as Weight Watchers or some other type of Noom, some diet and exercise type of routine, only about 5 to 10% of people are able to lose 20% of their weight. So now you're getting close to 70% of people being able to lose that 20% weight loss with this treatment. So that's really why it's a life-changing treatment for many people.
There's also a brand new study that suggests that Wegovy cut the risk of heart attack, stroke, or death from cardiovascular issues by 20% among those with heart disease. Talk to us about why this is significant.
Well, this just came out today, which was very exciting today for all of us in obesity treatment, as well as all the patients with obesity, especially those that have known cardiovascular diseases. So if you have a cardiovascular disease and you have obesity, those patients that took Wegovy had that 20% reduction in their heart attack, stroke, or other type of cardiovascular risk. This is hugely important because those patients were also already on effective treatment, such as the statin drugs, to also help reduce their risk. So this was on top of the current standard of care for people with cardiovascular disease. This is a huge step forward, and I don't see how any insurance can now deny coverage when we have such a great benefit as it relates to a reduction in death from cardiovascular disease.
I can see a lot of our viewers potentially watching this and saying, this sounds like a no-brainer. I want to call my doctor and talk to them about it today. We are seeing a rise of concerns as well. What do patients need to know? What are the risks of this?
Well, as with any treatment, you have to assess the risk and the benefit, and you have to make sure that the benefit is such that it is acceptable risk. These medications don't have a lot of risk. In the SELECT trial, which was just published today, the trial you're talking about, which showed the decrease in cardiovascular risk, went on for over 3 years. And so again, looking at that data for a longer period of time showed that there was no increased risk of cancer, there was no increased risk of pancreatitis or other types of issues that we might have been concerned about in the past. So again, it did show that the safety of these drugs is very tolerable for many patients.
Okay, Dr. Eli Fitch, I appreciate your time. Thank you so much. Thank you for watching. Go to newsnationnow.com to find News Nation on your television provider. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.